And one of the problems it had was with technologies which were poorly defined. For example, memory clinics. And NICE tried to do a technology appraisal to determine the cost effectiveness of memory clinics. And they discovered there were about 17 different models of memory clinic. And so that was thrown back to the academic community and to the clinicians, the providers, saying, listen, you guys, you need to do a little bit more work to decide what is the most effective model for memory clinics, which again can be scaled up and which can be replicated. And then we'll do a technology appraisal on that before we issue our recommendation. Because when NICE issues a recommendation on a technology to the NHS, it is obliged to not only to do it, but also the central government is obliged to fund it. So that's kind of a useful implementation challenge. Now, I'm not sure, are you from Canada or from the
many countries?
Many countries, okay. Different countries have different models. Germany has an organisation a little bit like NICE. Some of the Scandinavian countries. I'm not quite sure what the current status of ARC is, and I know it doesn't write guidelines, but it has its practice centres and so on. But linking with, I think, with the governmental health technology assessment programs and centres is a good tactic for academics. I'm quite conscious of the time around coffee and things.
Please join me to thank Jeremy for this.
Welcome to the third day. Our today's speaker is Professor Dennis. It seems to me quality, if you look at as an indicator, quality of the School of Information Science, any school with many emeritus professors, then I think it's a better quality. So I'm collecting quite a few here. So without further ado, I'm going to introduce Jochen Meyer.
Good morning, everybody. I'm at the age where I need help. It's a real privilege to introduce our keynote speaker this morning, Dr. Dennis Prati. Dennis has been an iconic figure at the School of Health Information Science, not only because of his impressive physique, which makes his wife Pat refer to him as the big guy. Dennis is also an iconic figure because, as nobody in this room knows, he founded the School of Health Information Science, and he has been its director for over a decade. And of course, in the early years, Dennis was able to steer the school through around many a cliff. It was more than once on the brink of extinction. But meanwhile, the school approaches its 30th anniversary. It has 9 emeritus and full-time faculty and something like 30 adjunct faculty. And it has graduated hundreds of students who, all over the world, fill prestigious positions. So one can confidently say that the school is well established. But of course there's much more to Dennis Prati. And if we start with his research, he has identified very productive and rare research niche. Rather than tinkering with technology, he goes after the question what it really is that makes e-health innovation succeed. And in pursuit of this question, he evaluates systems, compares strategies, policies, management approaches at the regional, national, and international level. And hand in hand with this research interest goes a particular and unique approach to communicating his insights, findings, and recommendations. His 20 publications in refereed journals are a respectable body of work, but they are almost incidental to Dennis's real legacy. I think these publications is not what Dennis is really about. Dennis has always maintained that his real intended audience are the people who use information and communication technology for the betterment of healthcare and for the betterment of health of the populations served by them. And in order to reach this audience, Dennis went out of his way and left no stone unturned. He has well over 500 special publications and lectures to his credit, including 200 lectures, and on top of that, numerous workshops and seminars and conferences which he organized and contributed to. And that at many academic and professional institutions. A stellar example is, of course, the Partnership in Productivity series of seminars, which both Pat and Dennis Brody organized annually. Those were three-day-long conferences which brought together CIOs, CEOs, the brass of health industry and of healthcare governance from Canada to discuss healthcare in Canada. And this was done year after year for 20 years, from 1985 on. And the principle is still, as we heard yesterday from Dick Alvarez, continued. And I think it has been something like 26 conferences in the meantime. The achievement of Dennis and Pat is perpetuated in the Dennis and Pat Crotty Endowment Fund, which was established in 2004 with an initial $100,000, and in the meantime it has grown to many times that size, and a great number of selected exceptional students have benefited from it. Dennis is also a founding member of what later became the American Medical Informatics Association, and he was elected a fellow of the American College of Medical Informatics in 1989. He is a founding member of COACH, Canada's Health Informatics Association, and he served as its president in 1980 and received a life membership in 1982. He has, in addition, served in many capacities in the International Medical Informatics Association, among other as organizer of conferences and workshops and as the chair of its Working Group 1, the Education Working Group. And on top of all this, Dennis has served as advisor to scores of institutions and bodies nationally and internationally, in China, in Brazil, in practically every European country, and of course in the United States and Canada. And the institutions who were seeking his advice include the Canada Institute for Health Information and the Canada Health Infograde and the National Health Services of the United Kingdom, just to name a few. Dennis' accomplishments have been recognized by many prestigious awards and honors. In addition to those named already, he has received an honorary Doctor of Science from the City University of London in 2009, and Leadership in the Field of Health Informatics Award from COACH in 2008. But Dennis has yet another characteristic, which I think is very important, because without it, I'm sure he wouldn't have been able to achieve what he has achieved. And that is a very special gift to create and sustain friendships. This assembly here is proof of that. And if you have been outside these days, you will have noticed what extremes he goes in order to make his friends from other parts of Canada feel at home, welcome in Beyond that, Dennis' friendships include his many students, his alumni, his peers, his co-workers, colleagues. But he also has, of course, a very large circle of friends in his community, in his parish, and in his neighborhood. So Dr. Dennis Proddy is no doubt a giant in medical informatics, but he's also, importantly, a giant in friendships. And he is an absolute beacon when it comes to family matters. So join me in welcoming Dennis Proddy for his lecture.
Thank you very much, Joachim. As I said last night, I'm a bit uncomfortable with all these kind words. And, I think of your contribution to the school, really significant contributions to the school. And, I can't thank you enough for all you've done as long as many other in this room. Can you hear me by any chance? Mic's working? Okay, good. John, where's my talk here? I'll get started. Sorry? Raise the microphone. Is that better? That's better. That's my sweet little daughter. Who's always kept her father in line. And you know, I was blessed and surprised to have all three of our children join us here. So it's very, very special time. I'd like to dedicate my comments to Dr. Ken Thornton, who just recently passed away. A number of you probably remember Ken. Those of you who didn't, he was a pathologist in the Royal Jubilee Hospital. He was a key person to interview me for my job at the Jubilee Hospital when we moved to Utah in '79. And he was also very, very influential in the school. One of the first lecturers we had in the school. And a lovely man, a wonderful, wonderful scholar. And I'm sorry that he just passed away from his long, productive life. I'm going to try to skip through this as quickly as I can. I fear I may have too many slides, but I'll try to keep an eye on the clock. I decided to approach it by trying to think back and reflecting and looking back over the 44 years I've had in this wonderful field and broken them up into decades. And finish with some closing thoughts and reflections. Through the course of it, I will try to sort of give you a little bit of insights into where I spent my life in this field of health informatics. Starting in the medical school in the University of Manitoba back in '67 through to 6 wonderful years at St. Boniface Hospital in Winnipeg, and then a couple of interesting years at the Jubilee Hospital here in Victoria, and then of course the majority of my career has been at the school. 1967, when I started, was a long time ago, and just to give you a feeling for those of you who are too young, that's when we were celebrating our 100th anniversary of the country. That's when the first Boeing 737 came out, playing the WestJet flight exclusively with Western Airlines, probably the mainstay of the airline industry. That's when we got O Canada as our official national anthem. In fact, that's when it all started. We had the famous Expo 67 in Montreal, and for those of you just a reminder for the center of Canada.